Hey everyone, so today we are going to talk erectile dysfunction drugs. And as you will notice, there are a lot of fun stock photos in this presentation. So let's get started. So what is erectile dysfunction? Well, it is a disorder when a man cannot keep an erection firm enough for sexual intercourse. Now, there's lots of potential causes. Many of the very common causes are actually medications. I would say the most common culprit for erectile dysfunction is probably antidepressants. Lots of people take antidepressants, and unfortunately, that does tend to affect sexual drive and the ability to maintain a firm erection. However, there are other drugs which can also cause erectile problems, namely a lot of antihypertensives, a lot of blood pressure medications, which makes sense. If you have a lower blood pressure, it's not going to have as much blood flow going where you want it. So these would include beta blockers and other antihypertensives. Chemotherapy drugs can also affect sexual performance, as well as diuretics and opioid analgesics, those opioid painkiller medications. Now, in addition to that, medical conditions can also be potential causes for erectile dysfunction, namely anxiety and stress, depression, hypertension. So ironically, right, we have antihypertensives can cause it. Also, hypertension itself, high blood pressure, can also cause erectile problems. Low testosterone, of course, as well as hormone imbalances, and obesity can also be a factor. And then, of course, we have lifestyle factors, or what we like to call modifiable factors, because if you can make a change, you can oftentimes avoid having to take medication for erectile dysfunction if you are to change these factors, such as a lack of exercise or smoking. So oftentimes, if you can convince someone to stop smoking or to start exercising more, it can help with problems with keeping that erection firm enough for sexual intercourse. Now, we have these phosphodiesterase 5 or PDE5 inhibitors. What does this mean? It's just a fancy word for drugs that are used to treat erectile dysfunction. So what they do in order to work, they dilate the arteries in the penis to increase and maintain blood flow for a short period of time. This is normally about 1 to 4 hours. Big drug interaction here. Do not take them with nitrates. That makes a very, very high potential for a heart attack. So when I'm saying nitrates, I mean your Ismo, your Imdur, any of those nitroglycerin drugs that would normally be for chest pain. You cannot take those because you have a much greater potential for having a heart attack if you take those PDE5 inhibitors with those. Side effects, surprise, surprise, priapism, which is an erection lasting longer than 4 hours. If you've ever seen these commercials, you know that you should call your doctor if you have an erection lasting longer than 4 hours. Basically, why we should do that is anything longer than 4 hours, that's a lot of blood flow going where it should not be there for a concentrated period of time. So it becomes potentially dangerous and can actually damage the penis. Now, we have dizziness, headache, hot flushing or reddening of skin. Those are all fairly common side effects with these PDE5 inhibitors, as well as dyspepsia, which is painful swallowing, and a little bit something you might not think of, but nasal congestion as well. Generally, these tablets are taken 1 hour before sexual intercourse. So what are our examples? Well, we have the little blue pill. And I should note that all of the generics for the erectile dysfunction drugs, they all end in "fil," the FIL suffix. So if you're ever questioning what this drug might do, if it ends in "fil," it's going to be for erectile dysfunction. Now we have sildenafil or Viagra, and it's now generic. So this is probably the most prescribed. So it costs a lot less than any of the other potential ones. Now, it's also available as Revatio to treat pulmonary hypertension, which is high blood pressure in the lungs. So that's why a lot of people get a little bit shocked when they might see Viagra prescribed to a woman. So when you see sildenafil prescribed to a woman, it's not necessarily a typo. It might just be for treating pulmonary hypertension, which is high blood pressure that can lead to a pulmonary embolism or problems with blood clotting in the lungs. So that's the only time you'll ever see sildenafil prescribed for a woman. So keep that in mind. It lasts about 8 to 12 hours. Next, we have a tadalafil, which is Cialis. And you might know the commercials like Cialis for daily use, right? So it's the longest acting. It can act for up to 36 hours. And the nice thing is it's not affected by eating fatty meals before use. These other two, the Viagra and Levitra, if you eat a fatty meal, it might decrease the potency of the drug because it's absorbed in a way that has to do with fat absorption in the body. And lastly, we have vardenafil, Levitra, and that has the fastest onset of action. It's 45 minutes as opposed to, say, 90 minutes to 2 hours-ish. And it lasts about the same as timeline as Viagra, which is about 8 to 12 hours. So that is all we have for erectile dysfunction drugs. If you have any questions, feel free to contact me. Thank you.